We flipped the labs around, brought all the first-year students through, trained all the first-year students in IM injection, and then we deployed them all. So at the end of the day, we had never planned to train our full student body, but we did, and I'm really proud of everybody in the School of Nursing for making that happen for our community.
That's Kelley Strout, director of the School of Nursing at the University of Maine. As the pandemic persisted and vaccines became available, they made the major decision to train virtually all of their students to be able to administer COVID-19 vaccines. To date, some 400 students have delivered some 12,000 vaccines in hospitals, shelters, correctional institutions, and schools, among other places. I'm Ron Lisnet, and this is the Maine Question podcast. Training to become a nurse is no small task, and there has never been a greater need for their services. Nationally, there is a predicted shortage of about 500,000 nurses moving forward. In Maine, that number is around 2,700 nurses. The experience of helping out on the front lines as vaccines were rolling out made a significant difference in getting more people vaccinated, reducing the risk for all. It also gave these students valuable real-world experience in what their lives and careers would entail. What does it take to become a nurse? What kind of trainings and experiences do these students get? What is being done to train more students to become nurses at UMaine and elsewhere? How can the shortage of nurses be addressed, and how can burnout in this intense and vital profession be avoided? Those are just some of the topics that Kelley Strout addressed in this episode of the Maine Question. Well, Kelley, thanks for joining us. I know this is a busy time for you in particular and for everybody, but particularly for folks involved in the medical profession. I'm sure there's not enough hours in the day. But maybe you can, let's start here. Maybe you can give us an idea of what the last 20 months or so has been like for students, for people who teach nursing, for nurses in general.
I think the best way to describe it is a complete emotional roller coaster. I remember I was sitting in my office and we received the notification from the chancellor's office that we were going remote in March 2020, and our whole team met within 30 minutes to plan out exactly how we were going to support students through the transition to online learning and rethink the ways in which we teach nursing in every way. I mean, how will we convert our labs to online? And we were so engaged and just focused on a solution that no one really had any time to process what was about to hit us. So there was just a lot of energy that went into that. And then I remember there was a team from marketing that reached out and they wanted to talk to nursing faculty about what it was like to teach nursing online, because it's really not something we've ever done before. And about 6 of us went into this meeting, and honestly, this was about 2 weeks into the virtual online world we were living in March. And at one point he asked us a question, and I can't even remember what the question was, but everyone in the Zoom room just started crying, all the faculty. That was, it had kind of hit us what was coming. We were reading the stories out of New York. We were reading about how they were ordering extra freezers to store dead bodies and how overwhelmed the nurses were there. And we were just anticipating the worst here in Maine. So that was a really low and scary part of just not knowing what to expect. We didn't know anything about this virus in the beginning and how it was going to affect all of us. But as time went on, there was a lot of excitement. In the fall when vaccines came out, we were so excited. And I remember the first day that we started vaccinating nurses and healthcare professionals in December, early December, I started seeing pictures of my friends getting vaccinated, and I started crying, but this time it was more about joy and just a light at the end of the tunnel. And our students were so excited to start vaccinating the public, and the faculty, we were just everyone was on board. So it's been really a tremendous roller coaster of exciting new opportunities, of bonding together, working toward a common cause, but then also fear, exhaustion, loss. So we've probably experienced every emotion imaginable over the past 20 months.
I have no doubt. Now, There were so many needs and such a shortage of medical folks. The School of Nursing made a decision to train the entire student body to try and pitch in. Can you talk to us about that? That sounds like a major undertaking.
Sure. It was never our intention to train the entire school, but our stance since the beginning on the pandemic was to adapt and be flexible and work with the community to pivot to support the community's needs. So initially, when we were entering the spring of 2021, when vaccines were available, we had planned strategically to revisit and retrain all our students who are seniors in IM injections, run them through labs, have them complete the CDC trainings for the COVID-19 vaccine, and that was all implemented into the senior year curriculum. So we were planning to deploy around 100 nursing students. Well, we very quickly went through that supply. We've never been through mass vaccination at this magnitude before. So we were sending students 8 at a time in the beginning to Northern Light Health to support their mass vaccination clinic. But then vaccination grew. We started partnering with PCHC and which is Penobscot Community Healthcare, and they were aimed at vaccinating marginalized and hard to reach populations. So they were traveling to more remote locations, doing home-based injections, vaccinating individuals who are incarcerated in the jails, vaccinating individuals experiencing homelessness who are staying in shelters or maybe not staying in shelters, but we were going out to find people who needed the vaccine, traveling to senior housing sites to vaccinate our seniors in our community, and then also going to workplaces to make vaccine more accessible. And we really believed in this mission of maximizing access to the vaccine, but to do this, we needed more vaccinators. So I will say that in 20 months, I've never been told no by the faculty for any request or crazy idea that's come across this desk. So we first moved to the junior year students, and that's when they typically learn the IM injection. So by the time we knew we needed more vaccinators, they had already naturally been through that part of the curriculum. So we were able to deploy the junior students. And then once we exhausted that supply, I went to the second year faculty, and, they flipped their curriculum around to include lab days for IM injection training and CDC trainings. And then when we were in need of even more vaccinators, I moved down to the first year students, and we had a long discussion about, should we include first year students? Was it safe? And we collectively decided that it would, as long as we trained them properly, that it was a safe and important decision for our community. So we flipped the labs around, brought all the first year students through, trained all the first year students in IM injection, and then we deployed them all. So at the end of the day, we had never planned to train our full student body, but we did. And I'm really proud of everybody in the School of Nursing for making that happen for our community.
And so you're talking about more than 400 students. I think you gave me a figure at one point, more than 12,000 vaccines given. Talk about how the students have responded. And just to be clear, the training they are fully qualified to administer vaccines like any professional nurse out there. It's not like they're learning on the job, correct?
Correct. Yes, we train them all through our labs. And in our labs, we have the supplies and material. We have, the pseudo muscle pads, we have the needles, we take them through, the theory and the science behind the vaccination process, and then they're trained. And then the other important piece to note is that while they're out in the community vaccinating, they're also supervised by qualified registered nurses. So they're not just out there by themselves. They're supervised at all times. Our students, while it was an extra effort that they had to engage in terms of the training, I think that it was really a light in the pandemic that our students had the opportunity to vaccinate our community. These clinics were very joyful People were so excited to get a shot. We don't see that very often in healthcare, where you're just excited to show up to, a nurse or a doctor or a hospital or any kind of healthcare facility. Usually it's because you're sick, right? So the population who are coming to get vaccinated were just so grateful. They were so grateful for our students. Our students were just showered with gratitude and praise. I can't tell you how many people in the community have come up to me just to say how thankful they are that a UMaine student vaccinated them. So, they were living through history. This period will be in history books, and they're living through a public health case study in epidemiology. Also, our students were part of the solution, part of the way out, which gave them tremendous purpose. And the other really exciting piece that we just could have never imagined happening is the way we were staffing the clinics. There were many times where it could be a first, second, third, and fourth year student all together at the same clinic being supervised by one of our graduate students. And I was at one clinic supervising, and it was so sweet because the first year students had had a lab course in the morning, and they went to a vaccination clinic to vaccinate in the afternoon. And when they showed up, the upperclassmen were at the clinic also vaccinating, and the upperclassmen started cheering for the first year students because they were just so excited that they got that opportunity. So it's been incredible. And the other benefit is that our students have been recognized in the media and at a larger scale across the university, which typically they're not. So overall, it's just been a really rewarding experience for our students and our faculty.
Talk about some of the trends. I imagine there's a growing need for nurses. What are the trends like in the program at UMaine? Is interest growing? I know you have way more applications than folks you can take, right?
Yes. Pre-COVID-19 pandemic, the United States was facing projected shortages of registered nurses as high as 500,000 or 500,000. And in Maine, we also were estimating shortages of 2,700 nurses by 2025. This year, schools across the country, nursing schools, saw record numbers of applicants for nursing students. I think that was in large part contributed to the high media attention and recognition of nurses that you, again, don't often see. So people, potential prospective students, were viewing nursing as a career with purpose, a career that, quite frankly, seems recession-proof, and in a career where the professionals in that career are just beloved by the public. So we did admit our largest incoming class at UMaine Nursing, and with just under 130 students. So we also saw a record number of interest, particularly among Maine students, which we're really excited about.
So talk about the program here and how it's structured. How does one learn to become a nurse? How much is theory, basic science, and how much is learning the techniques and learning to diagnose and really getting your hands dirty? You have a lot of clinicals and labs. I mean, it's hundreds of hours that these students put in, right?
I think that it's really not well understood publicly what the students have to go through to earn their Bachelor of Science in Nursing. First of all, the first year of the curriculum is heavily science-based. It is a bachelor. The students do earn a Bachelor of Science. They take several lab-based science courses with the general education, humanities, and math. And that's the first year is significantly focused on that. And then starting in the second year, the nursing students start to engage in nursing courses. And by the fourth semester, they're almost exclusively enrolled in NUR courses. 79 credits of the 121 credits are nursing focused, but all of our nursing courses are infused with science, humanities, culture, quality, research. Everything is infused into each of our nursing courses. And then the other important piece that I don't think is often understood is that a nursing student enrolls in a clinical course for 2 credits. Okay, so typically if you're enrolled in a 2-credit course, you'll be in class 2 hours per week. But for a nursing student, that is actually 8 hours per week. So one clinical course at 2 credits is 8 hours per week. And so our students on average are in class, clinical, or lab for 26 hours per week. And that doesn't include any studying time at all. So and then those courses are very intense. So there's a tremendous amount of studying. So it's more than a full-time job just to be a nursing student.
So take us through the labs and clinicals the students have to do. How many hours? What do they learn? How do they learn it? And how ready are they to go out and do this for real once they've been through that experience?
That's a great question. We've been very strategic about how our curriculum is scaffolded. Our students start their first nursing specific labs in the first year, and that's designed to get them hands-on in the field and also determine if they like the major that they chose, so they can think about that early on. Once they start in the 4th semester, a full schedule of nursing courses, the way we have our labs and clinicals set up is every adult clinical course has an associated lab, and the labs are front-loaded, meaning that students take many lab hours at the beginning of the semester so that they can demonstrate all of their competency early on. That way, when they're out at clinical, when they're exposed to various skills and opportunities, they've already demonstrated the competency in the lab, so they have more opportunity to practice and engage in those skills with real patients and direct patient care. In total, our students engage in 180 lab hours. And then what they do is they front load all the lab skills. They go to clinical all semester. They take all of their didactic courses. And then at the end of the semester, they perform a simulation, which is a standardized scenario that allows us to assess their competency across lab, clinical, and class in a standardized way. So we either use a standardized patient, which is a patient actor who is trained to simulate certain medical conditions and certain behaviors, and then the student is assessed on their ability to respond and provide safe evidence-based care, or they're simulated using simulators, but for the lay public, it's a robot, essentially. So it's a mannequin that can talk, birth babies, have a heart attack, and then our students can practice in a safe environment on these simulators. Our students complete a total of 750 direct care clinical hours. So that is working directly with human patients in a wide range of settings: nursing homes, hospitals, jails, schools, across all populations: older adults, pediatrics, obstetrics, neonates. And they are ready to graduate. I mean, they have the 750 direct care hours, 180 lab and simulation hours, and then significant didactic coursework to prepare them. And of course, after they graduate, they need to take a national licensing exam called the NCLEX, and then they become registered nurses. And then they move into, most of them will move into year-long nurse residency programs where they will continue their training as registered nurses in hospitals.
So talk a little bit to us about burnout. We hear so much about that going on in the medical field, nurses, doctors, other folks that work in that field. Do you talk about that with the students, and what's that been like, dealing with the pandemic? I'm sure that, sort of gas on the fire a little bit in terms of that.
Yes, we are seeing burnout across the board, even with our students. The students, faculty, staff, the nurses all around us. And honestly, that has come fast and furious and been layered on top of, all these other challenges we're facing within the profession. The challenge to deploy staff and students to support staffing in the workforce, the challenges to deploy students to support vaccination, the shortage of nurses that was already existing before we entered this pandemic, the rigor of the curriculum and the challenges to get students through the curriculum. And then this burnout came with severe intensity, to be honest with you. So what we're doing, I recently applied for a grant that we should hear about very soon, that would enable us that would provide some funding for us to start to infuse strategies, mindfulness-based stress reduction, and other environmental strategies, maximizing the resources that we have on campus through the campus recreation center, through the counseling center, through the student wellness center, but intentionally infuse those throughout our curriculum and help guide the students through mindfulness-based stress reduction strategies so that when they graduate, they not only have the knowledge, skills, and ability to practice as safe and effective and evidence-based care, but they also have resiliency. They have mechanisms that they can control to support their own self-care and resilience and address the demands in the environment they're entering. Because at the end of the day, we can't change the environment that they're going to enter into. It's very stressful. The stakes are high. It's also a very human emotion. It's a profession with a lot of human emotion. So, you're going to feel extreme sadness potentially about the loss of a patient or circumstances in which you're facing with patients in your care. So we need to armor our students with resilience. And so that's really the goal where we're heading in the next phase of this pandemic, hopefully starting in the spring. We've started to roll out some strategies for our students right now. We just hired a student success coordinator, and she's collecting data right now on our students' common stressors, what resources that they feel they need to support their non-academic success. The other part of the student that isn't just about how they're doing in school and how they're performing academically. But in the spring, we really hope to intensify this so that our students graduate and are resilient so that they can combat burnout. Because we can't have, in this nursing shortage we're facing, we can't graduate nurses who then burn out quickly because they don't have the skills and the resilience that they need to face the demands of the environment.
Everybody thinks of nurses as pretty much only working in hospitals, but they are in a lot of other places besides that. Can you talk about some of the other places where nurses are present providing care?
If I had $1 for every single time I tell someone where I work, they say, "Oh, so you're not a nurse anymore?" I would be rich, because people, the society really envisions nurses as working in hospitals, but nurses are everywhere. We have nurses working in primary care, nurses caring for patients who are incarcerated in jails. We have nurses traveling to patients' homes who are homebound to provide wound care, medication management, assessments, hospice, supporting patients through peaceful end of life. We have school nurses who've just been completely unsung heroes throughout this pandemic. They've been instrumental in contact tracing and providing support for families and students and getting kids back to school. They've supported policy to support prevention of disease transmission of COVID throughout our school districts. And so nurses are everywhere, and they're really instrumental at a population level at preventing disease, improving chronic disease, treating patients from a physical and psychosocial perspective, in providing holistic care in all areas.
We've heard so much about the shortage of nurses out there. What is being done to sort of address that and recruit more people, try to get more people into the profession?
UMaine system in 2017 stated that we would double enrollments across all 4 of our campuses. There's been across our university system, there's been a concerted effort to increase enrollments. We need to focus on increasing faculty, because we can take in more students, but if we don't have qualified faculty to teach them, both at the clinical setting, in the labs, and then in didactic courses, then we cannot respond to the increases in enrollments. So we have been having conversation with our healthcare partners about what different creative models we can engage in, so that nurses could potentially, so they can work in the hospital or in other settings, other outpatient settings, but then also be supported to teach a clinical section for the various universities. So there's a lot of effort underway right now to think more creatively about how we partner to meet the demands and the needs of the faculty in nursing education.
Your students maybe didn't sign up for being on the front lines of this pandemic, but there they were, right? Has being involved in that way changed their thinking or their thoughts about going into this profession? I'm sure it runs the gamut. Some are more gung-ho and some are this is not for me kind of thing. So what is the range of reactions been like?
It's so interesting because I go back to the first question you asked me, how have the past 20 months been? And if you would have asked, and I had these thoughts back in March 2020, I was really worried about nursing students. I wasn't as worried about nurses exiting the profession at that time because, we are at least trained and exposed to infectious disease and other, wide ranges of medical conditions, with some experience under your belt. But I was a little bit nervous about students just saying, never mind, they're scared and just wanting to leave. And we did not see a mass exodus of students. In fact, we didn't lose any students throughout this entire pandemic due to the fact that they didn't want to be a nurse because they were fearful of the virus or caring for patients and the virus. There have been times when our students were nervous about contracting the virus. I think that has leveled off significantly with, we have more knowledge about the virus. We have vaccines. We know that masking works. So truly we haven't seen that. And in fact, in 2020, the summer of 2020, we graduate students twice per year in May and December. So we offered to the graduates of the December cohort to actually complete all of their courses in the summer. And our faculty taught summer courses to make that happen. And of the 35 students who were to graduate in December, 29 opted to graduate early so that they could go and fight, the pandemic on the front line. We've really seen an ongoing commitment to the profession from our students throughout this whole pandemic.
Look into the future. What do you think you'll see? What do you hope you'll see as trends and things coming down the pike for nurses and teaching?
Well, as someone who is, passionate and researches prevention and non-pharmacological interventions, and I truly believe that our public health infrastructure in our country and state was incredibly weak and underserved. And we saw that. We saw the implications of that in this pandemic. And so my hope and what I believe that we've learned from this is to invest significantly in public health and community health, value the role of public health nurses and nurses who work in the community, value prevention and behaviors that prevent disease, and see an expansion of research in this area and see nurses excited about working in these fields. That's really what I'm hopeful that we'll see in the next phase of our profession into the future.
Well, you guys are doing great work, and I know it's recognized, and we thank you so much for sharing your story with us.
Thank you.
As always, thanks for joining us. You can find the Maine Question in a number of spots: Apple and Google Podcasts, Spotify, Stitcher, and SoundCloud, UMaine's Facebook and YouTube pages, as well as Amazon Music and Audible. Please consider subscribing to hear all of our episodes. Questions or comments? Drop us a note at mainquestion@maine.edu. This is Ron Lisnet. We'll catch you next time on the Maine Question.